Hi, it's Jennifer Brewer. I'm just here at the Collingwood Hospital today. Just wanted to show my technique for dressing change of a PICC line. So first we're going to gather supplies. We're going to need some clean gloves. You're going to need your size of sterile gloves. You're going to need 2 aqueous-based chlorhexidine swabs. You're going to need a stat lock for the PICC Plus, and you're going to need the Tegaderm IV. This one is especially for a PICC line. There are different square ones or just plain IV or just plain Tegaderms, but we'd like to use the oval one for the PICC line. You're going to need a flush, and we'll also do a cap change too. So very first thing, there's a couple different techniques you can do with this to kind of hold and anchor your line. The outside I often will use, we'll just say this is my piece of tape, and I'll actually often use a piece of tape just to hold these in place, usually a little bit bigger, so that it does hold the line down when you're taking and removing the stat lock and you're not getting a lot of movement with the line, and so it feels somewhat secure. So to start, I always remove the old dressing with clean gloves, and for the most part it should have the tape on the outside, and we're going to, again, it's a little easier on a regular arm and with a bigger piece of tape. But the stat lock is going to stay, and we're just going to up and away. We want to pull this away from the PICC line, because if you're pulling it off in this direction, you have potential for dislodging. So then secondarily, we're going to remove the stat lock. The stat lock has these little plastic pieces that nestle the PICC line into it. Now to remove it, because we still have our clean gloves, if we actually lift this off, we still have our piece of tape here, we can just gently lift the PICC line and then hopefully remove the stat lock. Again, not usually as difficult when it's not on a model. That's pretty stuck here. Oh, might have lost some. But again, you get the gist that we're, for the most part, not actually moving the PICC line. We're not doing any of this with it. So it does tend to stay right in that spot. So then when you have your tape on here, you're able to anchor it down and allows you to get ready for the sterile part of the procedure. So once you've removed your clean gloves, you're going to open everything in a sterile fashion. It is a sterile procedure, so you do want to apply a mask if you aren't already wearing one. You're going to open and keep your sterile gloves nearby. I always open my swabs. I often will actually get the patient to help me with them, but I'll show you what I do when the patient can't. I set them up as so. Again, we're going to open this and not let it fall out or touch the edges. You have that 1-inch border that you don't want to have touching anything, and you can leave it down because it's easy enough to lift up. Now with the IV Tegader, because it's the last piece, as long as the back side has not touched anything, we can actually help ourselves by removing the date sticker and the anchor sticker. So I actually hold on to it this way, so it's still sterile. And then I can cleanly pick it up. I pull off this back and leave it on the opposite side. So then this is all ready to go. Your flush and your PRN adapter, we often do to the end, but I like to prime it and keep it ready. So we're going to I've taken the air out of the syringe and I've put a little bit in, so there's some fluid that comes out into the top of the cap. So then this is sterile and ready as well. So then the final piece you'll need for the cap change is a chlorhexidine wipe. So when you're going to do this, you do want to have sterile gloves on. So in order to apply them, you're going to open your package. You're going to lift each side so that they're laying, you can have this laying in your lap or laying on the table. And just for visual purposes, I wanted it a little bit closer. You're going to pick up with the one hand and you're going to just slide your hand into it and you can touch the underside of the glove only to bring it down over your wrist. Now with your left hand, you're going to put a couple fingers in to where the glove is folded, and then you're going to slide your other glove on. And again, not touching anything, then you have sterile hands. This is also a sterile surface that you do have, that if you do need to use it, I often will use it to pull out the chlorhexidine swabs, because the next piece is that we're actually going to clean it. So again, because I'm sterile, I can pull it with this, and then I will actually use my sterile field to pull the swab out. Then I take always in a clockwise motion and always starting from the very tip of where the PICC enters the body and always moving in an outward motion. So we're going to go out, and you can actually sneak under and around the catheter and around in a big circle. Then we're going to flip the swab and do it again. Big circles, all the way around. Now, if you're feeling more comfortable with, you can make this hand become unsterile and touch the line, or you can just still leave it intact, and then we can clean it with our secondary swab. I'm going to pick it up again, and I'll pick only a sterile spot. I'm going to get rid of these. And you want to go underneath the angiocath, or the PICC line, onto this side, and then using the other end of the swab. So I use this end underneath, and then flipping it on the opposite end to clean. So we also want to allow this to air dry. If we don't, what can happen is the chlorhexidine itself can cause the rashes that develop sometimes underneath. Because it's an aqueous-based swab, that meaning that it's water-based, the water, it doesn't allow for it to dry as quickly as if it was contained alcohol. But it is a requirement by the manufacturer that manufactures all of our PICC lines locally. This may not be the case if you're in a different region, but in Simcoe County, the ones that are done out of RVH are Boston catheters, and they do require that we're using the green swabs, or again, the aqueous or water-based swabs. So once I've allowed for that to dry, and again, we don't also want to do any fanning, we don't want to do any blowing, we just want to take the time, which is a lot of time for nurses. We really don't like waiting. But if you do, you'll actually find that the PICC line site lasts much, much longer. So the next part that we're going to do is actually apply the stat lock. So the stat lock, so I'm going to have to go on sterile with this because it flapped a little bit for me. Anyhow, that's just with my one finger. So we're going to just slide this underneath, again with our tape still being here and secure, and I can touch this all because it's nice and sterile and clean with my nice sterile gloves. And then you slide the one piece into there. Now the little blue piece at the back will then move and slide the other. Now we're going to keep it lifted off the skin and then push the lock plastic piece cover over on each side. We don't push onto the patient or onto the patient's skin because it can cause them a little bit of discomfort. So then once we're done, we're then going to anchor it onto the patient, and then there's a little butterfly flap on each side that will remove the backing and allow for the adhesive to be attached to the patient. Again, normally this doesn't come out so far, as you can keep it and remain anchored. And your next piece is then to apply the top dressing. So we're just going to take the back off of here. We're going to keep this slit right where the tubes come out. Often ours are single lumen. This one just happens to be a double lumen. And that's the kind of the line in where we want the slit to enter. And you can take tape off, lift that in. As soon as you're setting it on the patient, it's pretty much in the spot it's going to be. And then laying it down nice and flat to make sure that it's in the visual window. There's then the paper edging that comes across, and if you just follow it across with your finger, it comes off a lot easier. That is with any of the Tegaderm products. And now that I've removed the other, I'm just going to use one of these. You can use two if you would like. to go across. And that helps to anchor the PICC dressing down. Then the next piece with the flush, now you no longer need to worry about your gloves being sterile. They're nice and clean, but you are going to do a cap change. So again, this is a double lumen. You would do both caps. I'm just going to show you one. So you're going to take the cap in your hand. You're going to unfold the alcohol wipe. You're going to put the alcohol wipe around the cap base, and you're going to wiggle. Now, the wiggle in here is for 60 seconds. Again, nurses were not real great at waiting 60 seconds, or we think 60 seconds have gone by, and it's actually only been 5. It's because we're very time-focused, time-oriented. So, again, we're going to just swab this back, but that's what's going to give it a good scrub, a really good clean, so that when we go to take this off, because this line is open right into their superior vena cava, we want to ensure that we're not leaving that line fully exposed. So as I'm continuing to try to chat through it, it's when I usually have a little chat with your patient, see how they're doing, talk about any of their symptoms, any symptom management, so that you can use your minute wisely. Again, so when your minute's up, which I don't think I still am even up to a minute, we're going to then get rid of your swab. I always have my flush already. I take my cap off too. And then I actually usually still, this is old school, but ask the patient to turn their head, just because I don't want them breathing even in it, because again, it is an open line. And myself, I still hold my breath. So when I undo the cap, I go, okay, just turn for me. And normally I'd be holding my breath, I wouldn't say anything, but to tell you, I'm going to put a couple drops into the cap just to get it primed. Put your cap on, and then I'm ready to flush. So I have the line closed. I'm going to undo the cap, or undo the clamp, and then sometimes it gets squished so much that you have to actually give a little squish to the line, because if it's been clamped for a period of time. Then we want to draw back. So we do have it set up that we can see a bit of the blood in it, but again, as long as there's blood in the tubing, you know that then you do have an open line and you're okay to flush. So you would be pulling back on your syringe. Okay, I'm going to pretend I've got some blood back, and then I'm going to do a push-pause method. I'm going to push in 1 ml of saline, and I'm going to stop. Another ml and stop. Another ml and stop, all the way until I get to almost the last milliliter. And at the last millimeter, that's when I'm going to put positive pressure on the line and clamp. Now, again, if there's different types of, there's a power PICC. A power PICC, you do not have to put positive pressure on it. It will say actually on the PICC line if it is a power PICC. So just be aware of that. Everyone else that you are still going to put that last bit of positive pressure even at the very end. Okay, so and that's my technique on how to dress and flush a PICC line. And my last tip, which I always like to do, is there is on the top of our IV Tegaderm, you are going to, that's what dropped was my pen, I'm going to sign my name to it and put the date, so that then the next nurse is aware of when the PICC line was changed last, and then they know when their 7 days are up and it's time to change it again. Okay, thanks so much.